Hi everybody. Today we're going to talk about treatment and why it is so important when you're applying for SSD or SSI to get treatment. So Social Security bases their decision on not only your diagnosis, whether it's mentally, whether it could be schizoaffective disorder, major depressive disorder, or physically, a bad back, congestive heart failure, ankylosing spondylitis, but they also base it on, and they have to base it on, your treatment. What kind of treatment are you getting? So let's talk about treatment for mental health cases. So if you're applying for SSD or SSI on mental health grounds, it is extremely, extremely important that you get treatment. So what do I mean by treatment for that? That means seeing a psychiatrist and seeing a therapist and following their advice. Now, some people see a psychiatrist once a month. If the psychiatrist is the doctor that prescribes the medication. Some people see their psychiatrist once a month. Sometimes it's every other month. Sometimes even it's every 3 months. My preference is that my clients see their psychiatrist at least once a month, as long as they're able to, because that's, seeing your psychiatrist more often builds up more records, builds up a rapport with your psychiatrist. So it's very, very, very important to see your psychiatrist. Equally as important is that an individual, applying under mental health grounds, is that they see their therapist. Now, some therapists could be a psychologist or a licensed clinical social worker. So a psychologist is somebody that they have their doctorate. They're not a medical doctor, but they have their PsyD or their PhD. They're called a psychologist, or an LCSW, licensed clinical social worker. So a therapist is somebody where you sit down, spend a half hour, sometimes even an hour. It could be once a week. It could be every other week. I like my clients to see the therapist at least every other week. In a perfect world, it could be once a week, but every other week is fine, where they get to sit down with them and spend that time to talk to the therapist about all the difficulties that they're having, whether it's significant depression, anxiety, paranoia, hallucinations. Because with a psychiatrist, most psychiatrists do what are called just med checks. So they might spend 5-10 minutes, if you're lucky, 15 minutes, unless it's a private psychiatrist that's not through Medicaid. And they basically ask you a couple of questions and prescribe you your medication, and then that's it. Whereas with a therapist, you can sit down with them and spend the necessary time telling them all the difficulties that you're having. In addition to the difficulties I mentioned before, individuals might have difficulty concentrating, socially functioning, difficulty handling the public, difficulty handling going on public transportation, and so on and so forth. So what this does is it makes a record. So the more records you have when it comes to a mental health case, the better it is. Okay, so the second part of the equation when it comes to why treatment is so important is for physical cases. What do I mean by physical cases? Lower back problems, congestive heart failure, ankylosing spondylitis, lupus, cardiomyopathy, neurological impairment. So these are the problems that physically affect your body. Now, everybody usually starts off with their primary care physician. So if you have a major impairment that I just discussed physically, it's very, very, very important to see a specialist. So if you have heart problems, you see a cardiologist. If you have immune system disorder, usually see a rheumatologist. If you have a neurological impairment, cognitively, or you have neuropathy, you usually see a neurologist. If you have bad knees, if you have a bad back, a bad neck, hips, you see an orthopedic doctor or a pain management doctor. So it is very, very, very important physically to not only see your primary care physician, but to also see your specialist. In addition, for physical cases, it's very, very important to get what's called objective evidence. There's two types of evidence, subjective and objective. Subjective is what you're telling your doctor about your pain, your level of pain, how long you can stand, how long you can walk, how often you get out of breath, how often you get headaches. That's the subjective, what you're telling your doctors and what they're writing down. Objective evidence, which is very, very, very important also, are MRIs, EMGs, EKGs, echocardiograms. They're radiology reports, basically. So, if you have a bad back, you have really bad back pain, you get what's called an MRI, and it determines the extent of the damage to your back. And if you have neuropathy, or if you have radiculopathy, where the nerves are affected, you have numbness, tingling, weakness in your hands or your feet, you can get what's called an EMG, which will determine or carpal tunnel, which will determine the extent of the nerve damage that you have. And if you have heart problems, a nuclear stress test or an EKG, echocardiogram will determine how your heart is functioning. The echocardiogram and nuclear stress test will give you what's called your ejection fraction, which will say, okay, what percent is my heart pumping at? And without this evidence, especially today, and things have gotten a lot tougher over the past 2 or 3 years, if you don't have this evidence, and as much evidence as possible, it's very, 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 very difficult to win. So this is why it's so important, whether it's a mental health case, physical case, to see your specialist.